Hi friends, hope you all are fine. Today I'll discuss about the failure of chemotherapy for tuberculosis when the patient fails on treatment of tuberculosis. Friends, short course chemotherapy which is provided from DOT center which is for 6 to 8 months duration. We include rifampicin in intensive phase. That is a course which is most effective one, and in theory there should be 97 to 99% of success rate, but in practice we don't achieve that rate. Patients are not cured, and many patients are failure on treatment, like they don't get cured. Sometimes patients get relapse of tuberculosis. So these are the different aspects of treatment of tuberculosis. I'll tell you the causes of failure of chemotherapy. A diagnosed case of pulmonary tuberculosis, when put on treatment, we expect 100% cure rate. The patient will be cured totally. But in practice, it doesn't happen. Actually, there are few factors related to patient, related to health service, and related to patient's immunity, patient's profile. Lots of things are there. So there are causes why this failure can happen, and we as a physician, we have to determine, we have to detect those causes and remove them so that we can give 99% cure rate. Friends, the first cause may be inappropriate regimen prescribed. Inappropriate regimen mostly happen in private setup. Here I don't blame anyone, but in different corporate setup or who do private practices, they are not up to date. Sometimes they don't have training for new updates in tuberculosis, and they most of them have the old thought of treating those tuberculosis, old procedure, and they are not that much worried about the result of inappropriate regimen. So I have seen many prescriptions where there is wrong combination of treatment and inappropriate doses and random selection of drugs without any justification, and because of that many patients develop this failure of treatment, like patient is not cured, and many patients develop even multi-drug resistant tuberculosis also. So I don't say here that in government setup it cannot happen, but yes, in private setup it's more. And if we combine this private and government setup, and if we have a good coordination between government and private doctors, then probably we can remove this problem. I have already made a video on government and private partnership, and you can go through that video how we can develop that. Anyway, so here inappropriate drug regimen can lead to failure of treatment. Then next is irregular drug intake. This is a patient fault, like on the part of the patient and patient family, but they have to be very cautious in taking the treatment, in taking the medicine regularly as advised, and do the follow-ups. But few patients who are like, as the patient has to take the treatment for 6 to 8 months, few patients are reluctant to take, and there are few factors like when the patient improves a little, then he leaves the treatment. That okay, I'm now good, so I need not take the treatment. But it's not so. You have to take the treatment for 6 to 8 months. So there is one cause, and that is when some patients who are alcoholic or take some drugs or drug abuse are there. In that patients, they are reluctant to take treatment. They are more inclined to the habits, their alcohol intake or drug intake. They don't take the medicine properly. So that is one case. Some patient, when they develop some problems after taking the medicine, some vomiting or some GI upset, then also they sometimes leave the treatment. Sometimes patient is put on treatment, after taking 10 or 15 days he feels better, then he leaves the treatment. Again after 7 or 10 days he is feeling sick, again he takes the treatment, he takes the medicine. So that type of irregular intake can lead to this failure of treatment. Then premature discontinuation of treatment. Of course, I have seen many alcoholic patients, they leave the treatment after taking 2 to 3 months. Then obviously there will be failure of treatment and sometimes relapse or multi-drug resistant tuberculosis. The drug toxicity is a cause. Some patients after taking the first dose or second dose develop severe drug toxicity. Though treatment of tuberculosis like rifampicin and isoniazid, they sometimes have some side effects like gastrointestinal side effects, urticaria, or sometimes some hematological manifestations, flu-like syndrome. So there are few side effects. I have already discussed these side effects of anti-tubercular drug in another video. You can go to that video. Okay, so drug toxicity can be a cause of failure of treatment. Because of drug toxicity, patient won't take the medicine in time or regularly, then there will be failure of treatment. Then next cause can be initial drug resistance. When the patient is diagnosed as pulmonary tuberculosis, if we don't know the culture or CB0, then we don't know the pattern of sensitivity. In that case, if we put the patient on treatment, patient can be failure of treatment, patient won't be improving, and it is because of initial drug resistance. Patient is already infected by a resistant bacteria. That can be a possibility, though it is rare. This is a possibility. Then next is if the patient is having some other disease along with tuberculosis, like diabetes mellitus or some immunocompromised state, then in that situation patient might not improve. And in diabetes patient, what happens is if blood sugar is not controlled, patient takes the treatment, the chemotherapy for tuberculosis, then also patient can be a failure because the blood sugar is not controlled. And then next can be tuberculosis complicated by empyema or bronchiectasis. That in that case there is pus inside the lung and patient might not improve if we don't treat this empyema and bronchiectasis. Actually, it is very difficult to treat empyema medically. Some patient might need surgical intervention also. So these are the causes of failure of chemotherapy in case of tuberculosis. And if we know these causes, then only we can assess whether the patient is improving or not, or why the patient is not improving. We can identify the cause when we know the causes. That's all for today. Thank you for watching this video and stay